Okay, so welcome everybody. Thanks so much for joining us. My name is Maya Schonbach, and I'm a clinical psychologist, and I work here at SkinPick. And today we're going to be exploring the connection between trauma and skin picking. So we'll talk a little bit about what we know, what we're still learning. We'll talk about the nervous system, about our emotions, about personal history, and we'll talk about how all of that can really play a role. There really are a lot of different ideas out there about skin picking or dermatillomania and trauma. And some are helpful, some are confusing. And this session really is about kind of grounding ourselves in evidence, to challenge misconceptions that you have, with that you've heard maybe, to offer, to have clarify things, to validate, really where things are most needed. So we'll get started with that. And I also want to mention that there is a discount. If you stick around to the end of the presentation, I'll share a discount for joining our program, for joining Skit and Pick at the end. So before we dive in, let's give a brief overview of what we're going to talk about. So we'll start off with some myths and facts about things maybe people have heard about or you believe. We'll start defining our terms. So going into what's trauma, about the nervous system, about emotional triggers and trauma themes. Then we'll examine some of the latest research. And then finally, we'll talk about some practical treatment relevant takeaways. And then finally, and very importantly, we're going to have a Q&A at the end all together. So I really recommend that you guys write into the chat, even if you have a question that comes up throughout, and then we'll go through the questions together at the end of the presentation. Oh, and I forgot to mention, we have about an hour together today. So let's get started. So let's start by unpacking some myths together. So these could be ideas that show up honestly in therapy offices, things you might have heard on social media, even in research settings, these can show up. And some of these might not hold up under scrutiny. So today we'll go on over, in this presentation, we'll go over the topics more in depth, but let's go into some with a brief overview of them right now. So let's start with a big one. What do you guys think? Trauma causes dermatillomania. What do you think? Is this based in evidence? Is it a myth? Is it a fact? Think to yourself. So it's actually a myth. It's because it's not that simple. So many people are told that their behaviors, they must be a result of trauma. Now, for some people, that's definitely true. But for many others, it's actually not. And what research shows is that trauma can influence how we regulate ourselves, how we soothe ourselves. And sometimes skin picking, we'll talk about this later, becomes a tool for managing those internal states. But really, it's not always about the past. So we'll talk about this more, but really about the patterns that we develop. So in short, not that simple. Next, myth or fact. Dermatillomania is a form of self-harm. So this could bring up a lot of strong feelings for a lot of people, especially people who have maybe been misunderstood. So think to yourselves, is this a myth? Is it a fact? Is dermatillomania maybe self-injury under a different name? Myth or fact? Actually, this is also a myth. And this is an important one to kind of debunk. So the key difference here is the intent. So the intent behind dermatillomania is typically about soothing, self-soothing. It's not about punishment. It's not people aren't trying to hurt themselves. It's considered more of a coping behavior rather than destructive behavior. And really, really important to make that distinction. And especially in therapy, that's very important to differentiate. Now, myth or fact. Everyone with dermatillomania has unresolved trauma. So you may have heard that picking your skin means you must be dealing with unresolved trauma. That could be something you've heard, well, maybe on social media, but is that actually true? Myth? Also a myth. Lots of myths here. um, Many people with dermatillomania actually have no trauma at all. I can say many people grew up in maybe safe, loving homes. And very importantly, to say that there's no universal trauma pattern for people with dermatillomania. So um, it's also important because sometimes people feel pressured to kind of find a trauma, and maybe it's not something that fits with them, and then that can get in the way of the real treatment. And really, I want to emphasize that dermatillomania is valid with or without trauma. People can be struggling with it without having a big traumatic life event. So this is definitely very important for us to debunk. Um, and lastly, myth or fact, dermatillomania helps people regulate emotions. This is looking more at function, not at cause. So what role do you think picking actually serves kind of in the moment? Is it a bad habit? Is it something more? Think to yourselves. You can also write into the chat if you feel like it. Fact. So this one's true. So skin picking often functions as an emotion regulation strategy. It's nice to kind of reframe it as this. Um, so picking can often help people feel calmer, more focused, more in control. It's a coping strategy. It's not a great one, but that is often a helpful way to reframe it like that and to kind of understand that it's not about stopping the behavior. It's not just about that. It's about understanding what it does for the person, what the function is of this behavior. Um, okay. So now that we've gone into some of the brief myths or facts, let's actually get into defining what is trauma. It's a big, big word. Okay, so let's start kind of big, broad, and look at the APA definition of trauma. So the APA is the American Psychological Association, and they say that trauma is any disturbing experience that results in significant fear, helplessness, dissociation, confusion, or other disruptive feelings intense enough to have a long-lasting negative effect on a person's attitudes, behavior, and other aspects of functioning. So functioning here. Traumatic events include those caused by human behavior as well as by nature, and often challenge an individual's view of the world as a just, safe, and predictable place. Okay, so really, what is this saying? This saying that trauma isn't just about what happened, it's about how the experience affected a person also over time. So it includes not just the event itself, but also your internal response. So talking about the fear, right? The helplessness, dissociation, confusion, really a long-lasting disruption to your ability to function or your worldview also. And then it's also important to note that they're saying that it can come from both human actions, things like abuse or violence, but also from natural events. So things like an earthquake, um, big fires that have been happening. Those are things that can be very traumatic. And again, kind of a thing to emphasize is that what makes something traumatic isn't just the event, but it's the psychological impact that it leaves behind. So let's dig into this idea a little bit more. So trauma isn't just what happened, it's how that experience was processed by your nervous system, by your body. So things like a fight or a harsh comment or even a medical event, it's not automatically categorized as trauma. Trauma happens when an event overwhelms your ability to cope and to regulate yourself. So also something important to say is that one person might experience an event and move through it. Maybe they have support, maybe they have coping skills, and another person might move through the exact same event and store it in their body, in their nervous system, in a way that ends up disrupting how they feel, how they behave, or how they view and trust the world. And this is really important because it helps us move away from labeling things as weakness and labeling people based on events, and instead to meet them where they are with compassion, with curiosity, and to understand that it's about overwhelm. It's overwhelm to your body. It's overwhelm to your nervous system. So this is a very important distinction to make. Okay. Um, so trauma doesn't always show up in memories. It really often lives in the body. So that could look like constantly feeling on edge. So that's something we call hypervigilance. It could also be being totally checked out. So numbing, shutting down. Um, Emotional swings are very common. Panic response. Those are all maybe potential signs that of trauma that's being held in the nervous system. And this is also part of why trauma can be really hard to identify because it's not always just about remembering a big event. Sometimes it's about noticing how your body reacts to the world around you. So yes, definitely it's considered embodied responses. They're not just memories. And it's really important to look at this because trauma really overlaps with things like dissociation or emotional reactivity, and those are kind of the symptoms, the like edges of this, and it could be based off of a traumatic response. So not all trauma looks the same. And again, not all of it comes from one extreme or some dramatic events. It's really important to recognize that there's different types of trauma, and these can all shape and change how we regulate our emotions and cope. So, acute trauma, that that's something that overwhelms the nervous system in one time event, so one blow. So it could be something like a car accident, a medical procedure, like a surgery, a sudden loss. Those are all things that could be considered an acute trauma. And then, in comparison, there's something called chronic trauma, and that's something that's building slowly over time. It's kind of like um, it's something that could be, for example, living with ongoing bullying, coming from an unstable home, dealing with chronic illness. And then there's also developmental or relational trauma. So these can happen when caregivers might have been misattuned. Maybe they were unavailable. Maybe the caregiver was emotionally unpredictable. And then this kind of trauma, it often impacts our ability to feel safe in our own bodies or really to know what we need. And so these distinctions between different types of trauma could be helpful because people um, with dermatillomania or with skin picking disorder may not always recognize that their experiences are considered trauma, especially if nothing quote unquote big happened. Sometimes it's really the slow, subtle, maybe repeated experiences, and that those are the kind of things that shape our coping patterns and our emotion regulation and our identity the most. And then again, I really want to emphasize that we're going through this and like looking at these terms, um, not for the sake of labeling or to pathologize. It's really important because we need to understand the context of all of this in order to really help us become more compassionate towards others and towards ourselves as well. So um, that's really important for me to say that. Okay, so then now let's talk about two kind of frameworks that help us understand trauma. So, especially when these are things that don't come from a single event, and those are kind of maybe the more subtle. So, ACEs are a framework called adverse childhood experiences. And they include things like growing up around substance abuse, experiencing emotional neglect or instability in the home. And these experiences don't always look like trauma in the traditional sense, maybe, but they really have a huge impact on shaping the developing both the brain and the body and and shaping how they respond to stress. And then this also brings us to another framework or another sentence called too much, too fast, too soon. And so, really, this is saying that trauma isn't always about what happened again, it's about what overwhelmed the nervous system before you had the capacity to process it. That's the important thing. So, for example, it could be a child who might have had too much responsibility too early, or somebody who went through a severe breakup or a severe illness at a time maybe when they didn't have the support. And this kind of, again, this kind of language really helps us to depathologize and to make us more compassionate and understanding. Because it really, especially when we're talking about young children, it's not about blaming the parents, not only young children, adults. Not about blaming the parents or digging up the past. It's about really understanding what the nervous system experienced as overwhelming. And again, for every person, it's individual. And to understand what the nervous system it might be still trying to manage right now. And then to connect that to dermatillomania, which we'll do shortly, that unresolved stress can show up as emotional sensitivity or difficulty regulating. And then that could kind of lead you to move towards using repetitive behaviors like skin picking to bring some form of relief or feel a type of grounding. So really it's about what was missing also as much as what happened. Sometimes that's also something important to look at. So again, so why does any of this matter in the context of dermatillomania? So really what we've seen so far is that trauma, um, it doesn't cause dermatillomania per se, but for some people, traumatic events can create an internal kind of landscape that then makes behaviors like skin picking more likely to develop, to happen, and to kind of stick and to become almost habitual. And why is that? Because trauma impacts emotion regulation, so how we feel emotions. It can impact how our self-image and body connection, so how we stay present in our bodies, and impulse control. And trauma can definitely impact impulse control and how we cope with things when they feel overwhelming. And these are all really key areas in BFRBs, in skin picking. BFRBs is body focused repetitive behaviors, if I haven't said that yet. And why is that? Because dermatillomania often shows up in those exact spaces. And it could be as a tool to kind of manage or regulate when you don't have other strategies that are available or feel safe or that you've even learned or have modeled for you. So again, trauma is one piece of the puzzle, but it's not the whole picture. It's not always part of the story. But when it is, again, I want to emphasize it's not about blame. It's about understanding why the body in your brain might end up turning to something like skin picking as a solution. And then that kind of brings us into the next section about trauma living in the body. What does that mean? And how can we use this information to work about healing and regulation? So let's talk now about the nervous system and the body, because like we said, that's where trauma and regulation kind of lives. And to understand this can maybe help us understand why picking can often feel soothing or automatic or feel necessary. Okay, so we each have what we call an internal regulator or internal control center that is our nervous system. And what that does is it constantly scans for safety or for danger. And when when our system is regulated, then we feel grounded, we feel connected, and we're able to choose how we respond to the different situations. But when our system is overwhelmed, then we shift into a survival state, into fight or flight mode, if you've heard that. And that's where behaviors like skin picking might show up as a way to cope. So, this is a really important concept called the window of tolerance. And this really helps us understand how we react to stress. So, this concept of the window of tolerance was actually developed by Dan Siegel, who's a clinical professor of psychiatry. And this model, it's founded in neuroscience, or the study of the nervous system. And so essentially what it's saying is that when you're inside the window of tolerance, you feel calm, you feel focused, you feel present. But if you have too much stress or unresolved trauma, it can push us above the window of tolerance into something called hyperarousal. And in that state, that's when you're feeling anxiety or racing thoughts, um, or below the window of tolerance. So too much stress can also push you down. So into hypoarousal, too little, into shutdown, into numbness. And what's interesting is that dermatillomania, skin picking, can come in both of those states. And it's seen as a way of regulating the too much or the too little. So again, you might notice picking when you're in the hyperarousal state, when you're feeling maybe wired or overwhelmed, restless, panicky. And then in that case, maybe the picking is done to help bring some feeling of relief from the stress, to focus, to maybe escape those feelings. Or you also might notice picking when you're totally blank, checked out, flat, numb, bored, watching TV. These are very common things. We call this automatic picking. And in hyperarousal, we often call that focused picking. Um, and in both cases, in the hyper and in the hypoarousal, the picking isn't random. Again, it's the body's way of doing something to help you shift your state. So sometimes it's to calm down, to bring you back down into the window of tolerance from the hyperarousal. And sometimes it's maybe to bring you up to feel something, anything at all, better than the hypoarousal that you're in. So again, I'm emphasizing I say this a lot, but I, it's important for us to understand that this terminology and understanding is to help us move away from judgment, from labeling, from pathologizing, and more into curiosity and compassion. These are very important. Okay, so now let's shift from talking about the nervous system to the emotional world. Okay, so many people with dermatillomania notice specific emotional states that tend to show up either before or during or after picking episodes. And these can include very commonly things like stress, um, feeling overstimulated, just feeling bored, feeling understimulated. Um, and then the emotional patterns can also be deeper, things like chronic perfectionism, social anxiety, feelings of shame, and feeling shame around other emotions, maybe around your appearance, maybe of feeling too much or feeling not enough. Um, and these emotional kind of cues, they're not the cause of the skin picking, of the dermatillomania, but they often kind of set the stage and are part of the landscape. And then here's where trauma might enter the picture. So for people with trauma histories, their brain may be wired to look for some form of control, especially over the body. And then picking can become a strategy for managing that, kind of a way to, like we said, feel something when you feel numb, or to fix, maybe fix what looks kind of wrong or what feels wrong. Maybe I feel a bump, a blemish, and I want to fix it. Um, but it's this kind of attempt at control. And then that doesn't mean that trauma caused the behavior, um, but it could help explain why the behavior, it becomes so compelling, why you feel like you need to do it. Like we have clients that say, I need to do it. I don't know how to not do it. So that's why it's so, so compelling. It's something that is very deep inside the body. Can. So I want you to take a moment, and think about this. What emotional states tend to come, right before or right after you're picking? Even subtle things. Think maybe if there's a moment maybe of tension, um, maybe an urge to disappear, maybe a critical voice in your head. Try and be curious. Um, And then these patterns, it's really important. You can write them if you want to share, you can write them into the chat, and we can look at them after. Um, but really, these patterns, can give you really important insight into your picking. And again, it's not for blame, but it's for awareness. And this can often be the first step, um, that you need to do for, treating your skin picking. Okay. So now that we've looked at the, emotional and the physiological kind of, landscape of skin picking disorder, let's turn to, the data. Let's look at some research. So let's look and see what the data is actually telling us about trauma and skin picking. Okay. So, a recent study, conducted by Spitzer and colleagues in 2022, they looked at trauma, how trauma and skin picking can be related, which is good for us. And what they found that was that people with skin picking disorder, um, they were actually, significantly more likely to report, oops, emotional abuse and neglect in their childhood. And in the study, when researchers looked at how different trauma types, um, related to skin picking, they found that emotional abuse showed the most, consistent and statistically significant association, um, with skin picking, more than any other form of trauma. And they saw that people who had experienced emotional abuse actually, were more likely to have more severe skin picking behavior, even when they took other factors, things like anxiety, depression, into account. So emotional abuse was, the strongest predictor of the severity of the skin picking. And then interestingly, they also found that 13.5% of the participants, they screened positive for probable post-traumatic stress disorder. So again, it's not the actual diagnosis, but likely. Um, and that is far higher than what you'd expect in the general population. The general population is around 4 to 5% that have PTSD, post-traumatic stress disorder. So again, this doesn't mean that trauma causes skin picking, but again, it can influence how we cope, how we regulate our emotion, um, how, we cope when things feel overwhelming. And then they said in the study that skin picking really can be a way to self-soothe, um, and to manage that kind of internal discomfort, be it soothing or to numb yourself through disconnection, or to actually feel something and to regain control and think about the window of tolerance to bring you back into balance. And then another interesting study done by Houghton and colleagues in 2016. So this wasn't done on skin picking, but it was done on hair pulling disorders or trichotillomania, which is a kind of cousin of skin picking disorder. It's one of the BFRBs or body focused repetitive behaviors. And they found something really important. So they found no direct link between trauma and developing hair pulling disorder or a BFRB. Uh, and what they specifically found was that trauma didn't predict who pulled their hair or how much they pulled. So, how much they were doing this repetitive behavior. And then they noticed something else also is that people who had experienced trauma, they were more likely to have depressive symptoms. So things like sadness, hopelessness, um, and then those depressive symptoms, they were the ones that were associated with the greater BFRB severity. So it's not so much that it's the trauma leads to the BFRBs, like pulling or picking. It's more like trauma, and like in the picture, trauma leads to this negative emotion of depressive symptoms, hopelessness, sadness, emotional numbing. And then that leads to more BFRBs, more pulling, more picking. And so in that case, they're really showing that the behavior is a coping mechanism, a coping strategy, or kind of a way to process to manage the hard to process feelings. And so again, this study shows that it's less so that trauma is the direct cause. It's more so that trauma leads to difficulty with emotional regulation, and that can lead to picking or pulling. Okay, and then one final study that I wanted to share with you guys is by Klosowska and her colleagues in 2021. And they found again that people who picked their skin more often, they had more, they, not more often, sorry. People that picked their skin had, uh, often had a history of emotional abuse or neglect. And again, the connection here isn't just about what happened, it was how the nervous system processed it. So here, the key thing is many of them also experienced dissociation. So a dissociation again is kind of feeling checked out, feeling in a trance-like state, feeling not fully present. Um, and then the researchers found that dissociation really helped explain how trauma um, might lead to skin picking. So, in other words, picking might serve as a way to kind of regulate the overwhelming emotions, or again, to kind of bring you up from the numbed out, the hypoarousal into the window of tolerance to make you feel something when you're otherwise disconnected. So, again, this reinforces what we've seen that for many people, picking um, isn't about like a bad habit. It's really about coping and helping you when your emotions feel overwhelming or hard to access or process. Okay, so now that we've really explored how trauma, emotion regulation, behavior, all of these are connected, and we've also looked at some recent research. Let's talk about healing. Let's see what it can actually look like. And again, not into perfection. It's very important. More about practical, what realistic tools, awareness, things like that. Okay, so again, we've seen how dermatillomania often functions as a maladaptive coping mechanism, something that people used to soothe themselves, to escape overwhelming emotions, to feel grounded when you're disconnected, or even to feel something when you feel numb. And then, so it's important. So rather than viewing the behavior as maybe irrational or something that you feel self destructive, we can understand it as a picking as a form of regulation that actually made sense in the moment, especially if you didn't have more adaptive tools, if they weren't available, if you didn't learn them. So, in that way, it's important to see that healing isn't about forcing yourself to stop cold turkey. I'm going to stop picking now from now until I don't know, until the end of time. um, it's really about learning new ways to regulate. Um, and so it's important to learn ways to cope, ways that work with your own nervous system instead of working against it. And really, this is at the heart of trauma informed therapy. Um, and it's about learning how to respond to your needs with compassion, with safety, and to the ability to choose instead of acting out of uh, fight or flight, out of survival, and about safety and not shame. That's very important. Okay, so like I said, it's not about stopping the behavior. It's about learning um, new ways for the nervous system to regulate itself. So, if you've ever heard of somatic tools, so I'm just going to go over some of these now, but I actually did a webinar last month. You can look on our on our YouTube channel at SkinPick, um, about building your own toolkit for dealing with skin picking. So there, I actually go through some of these techniques and tried them out. So the recordings on our YouTube channel. Um, so these are some tools. So somatic tools, so things like breath work, tapping. We went through the butterfly hug in the webinar last month. Things like grounding through your senses. A common one for that could be looking around where you are and seeing 5 things that you can see, 4 things that you can hear, 3 things that you can feel, 2 things that you can smell, 1 thing that you can taste. That's a really good one. Gentle movement. Um, so these are really things that can help bring the body back into a state of balance, back into from hyperarousal or from hypoarousal back into your window of tolerance. And those are also really important through the body, through somatic tools. Um, those are really good when words, when logic don't work, when you, even if you're talking to yourself, even if somebody's telling you everything's okay, calm down. Calm down is the worst thing to say to somebody, but um so these are really good because they really talk directly to the nervous system. They're talking about your body, and they really help you feel present and really safe, and safe enough to pause and to stop. Um, you can interrupt dissociation again gently. Cold water, taking a cold shower, cold plunge if anybody's brave. Things like naming objects, just describing to yourself, it could be out loud, it could be in your head, just describing what's around you. That can help you kind of get out of a dissociative trance-like state. Orienting to your environment. Um, Maybe naming 5 things of a specific color. Pick your favorite color, 5 red things, and find them around you. Um, and very importantly is self-compassion. So a lot of people have very deep shame around their picking. But really shame fuels the whole picking cycle. And so when we can soften towards ourselves, it's even when you're struggling, especially when we're struggling, that's when you can really make change. And it's important to say that when you're being self-compassionate, you're building acceptance for your emotional experience. um, Acceptance doesn't mean giving up. Acceptance really means saying, okay, I am doing really the best that I can do with the tools that I have, and I'm allowed to learn new ones. So, again, I want to emphasize that this isn't about forcing yourself to stop picking. It's really about slowly and kindly with compassion, um, really expanding your ability to and your capacity to connect to your body, to connect to your emotions, and then from that to have the freedom to make different choices in how you respond. So, okay, so what does progress really look like? So, when you've been stuck in a cycle, in a picking cycle, picking either to soothe yourself or to escape or to regulate, to bring yourself back into the window of tolerance, it's natural that you want immediate results, immediate change. Sorry to say, progress in this work doesn't usually mean, oh, I stopped picking completely. More often than not, it means, okay, I noticed the urge a little bit earlier. Maybe I paused, even just for a moment. It could mean I picked less, or maybe I understood more about why I picked. Those are all extremely meaningful steps. Okay. Um, and healing from trauma, meaning really learning, also learning new regulation tools. This all takes time. Literally, you are rewiring your nervous system, and you're doing this to help yourself feel safe in new ways. So again, the goal here isn't perfection. It's not about zero picking. It's really to allow yourself to have more choice, more options, more connection to yourself, more connection to others, more space, and especially less shame. So it's important for me to say that instead of maybe asking yourself, did I stop picking? Did I not pick at all today? Ask yourself, did I feel more aware today? Did I treat myself with more compassion, with more kindness? Maybe if I'm typically in a trance-like state, did I come back to myself a little bit faster? So those are the real questions to be asking yourself to kind of measure the change. So let's bring this all together. So we started by unpacking what trauma really is. So not just about the event or events, but about how the trauma impacts our ability to regulate and to feel safe in the present moment. So, for many people with dermatillomania, trauma or chronic stress really shape your emotional environment, how you process emotions, and that's where picking can begin. Um, so we talked about how the body has a big role, about how picking can serve as a form of emotion regulation, of self-regulation in moments when you feel overwhelm or disconnect. Um, Emphasize that it's not about causing harm. It's more about soothing or focusing, again, or feeling something when you feel numb or don't feel anything. We looked at emotional triggers, trauma related themes like perfectionism, shame, control, um, and thought about, reflected also about how they can show up just before or just after picking. And then we looked at the research. We saw that really there's a pretty clear picture that trauma isn't directly responsible for picking, but the trauma can lead to low mood, impulsivity, dissociation, um, and how all of those can make picking more likely, that this connection is indirect. It's more of a coping strategy. It's not a bad habit or a defect. And then lastly, we looked and kind of reframed healing. We looked at it not as a way to force yourself to stop picking completely, but it's more about building and learning new ways to respond to your inner world and to your needs and to your emotions, and to learn tools to bring you back into to connecting with your body, to connecting to your emotions, and to free up space for more choices. So I want to just highlight here that we have free resources both for subscribers and non-subscribers to our program. And really, we encourage everyone to use them. So, like I said, we have monthly free webinars. Like I said, last month I did one on building your own toolkit for skin picking, and we went through and practiced together some techniques. So you can see past recordings of lots of different webinars on our website, and also on our YouTube channel. So look up that. And then also on our website, skinpick.com, we have different online forums and blogs. You can access a lot of different information about skin picking, about treatment. Um, and then finally, I really encourage you guys to join our Facebook groups, follow us on Instagram, on TikTok. Really, those are really good uh, opportunities for community, really good place for that. Again, comprehensive center for information, treatment options. Um, look us up there. Um, and now first of all, the promo code for $100 discount off your first month of SkinPick, use the promo code PROWEB100. And if you have any questions about the program, you can email us at support@skinpick.com. And if you want to ask me something more clinical, you can email me at maya@helpingminds.com. So thank you all for joining, and we have some time now for Q&A. So I'll look in the chat. So somebody wrote, my experience with skin picking is that it increases when I'm angry and stressed, and I often blame and hate myself. And the skin picking is a punishment to myself and to my husband who thinks I'm beautiful. Isn't this a type of self-harm? So when we look at self-harm, it has to have, again, the intent of harming. I guess if you phrase it in that way, but I think here, even just from this one sentence of you saying, it increases when I'm angry and stressed. I see people raising their hands. If you can write into the chat your question, it's a lot easier than if we do it by out loud. So so I think the key is here is that you wrote when you're angry, when you're stressed, uh, blaming yourself. Maybe it's about beauty, about perfectionism. These are things, these are the underlying emotional triggers, right? So I think those are the areas to notice. And it's great that you've already noticed where it is. So um, that's kind of a way to start being self-aware and to think, okay, when I start to feel stressed, when I start to feel angry, maybe I can work on using some different coping mechanisms in order to reduce picking there, if that's something that you want to do. Another question, can skin picking give similar body sensations to sexual release? I am a woman and I often tell my partner picking feels better than orgasm. So, um, that's a great question. It's not uncommon for people to feel a very big release when picking, especially if you think about how we talked about um, picking in relation to emotional triggers, especially with trauma. um, it can definitely be related to maybe having a whole bunch of intense emotions, maybe being pent up, and then the release coming from picking, and then being able to release all those emotions. So if if you want to maybe work on finding a way to feel a release in a different way, then I would maybe look into maybe somatic um some somatic body movements. Here, I'll go back to that slide if you want to see. So maybe some tapping or some breath work, like maybe if it's something physical for you, then that's something that can help the release. Um, Somebody wrote, thank you for this. A 62-year-old woman who has struggled with SPD for almost 50 years, along with many other mental health challenges. These under somebody wrote basically that they're using the understanding of dealing with skin picking disorder to deal with a lot of other associated challenges. Um, Definitely writing about anxiety and depression as well. So that's definitely overlapping and connected, like we talked about, with kind of the low mood being the maybe the mediator between trauma and picking. Thank you for the uh, comment. So somebody wrote, there are 3 generations of pickers in my family, my mom, me, and my son. Could it be that picking is prompted by something other than trauma? Yes, definitely. That was definitely one of the first myths that we debunked. Some people don't have trauma. It could be a behavior that's modeled, right? We talked about it being a coping mechanism. So stress happens in life all the time, regardless of traumatic events or not. So if it's a way that of coping with stress, it definitely could be something that's modeled, especially if you're talking about these 3 generations. I'm in my head picturing your son watching you, watching grandma, um, picking maybe when they're stressed, maybe as, I don't know, a picking as cooking for a big I don't know, family dinner, and then that starts happening, and then maybe he learns that that's something that is a way to release stress. um that was just a image that came into my head. But definitely could be something, it could be a learned coping mechanism in that way. The name of the Facebook group is Skin Pick. If you look up Skin Pick, one word, you'll find it. Um, Somebody wrote that they disagree with the statement that skin picking is not self-harming. It sure is. The focus should be on the impact, not on the intent. Um, you're definitely right. The impact is very important, because at the end of the day, it's causing extreme distress and uh, multiple attempts at trying to stop and not being able to stop. It's very distressing. That's You're definitely right in that. That I was trying to differentiate in terms of ways that the intent behind it isn't always to um, cause harm. Somebody asks, is there any genetic component to BFRBs? Can it be in your DNA and have a particular gene that you can be prone to struggle with BFRBs? So the thing is that there's not enough research in this area. But in terms of one specific gene, no, there isn't. Um, there definitely can be like you can be predisposed to having. So skin picking is a BFRB, as you wrote. and BFRBs are kind of a cousin to OCD, or obsessive compulsive disorder. There can be kind of there is some genetic predisposition to this, like we see with anxiety. But again, it's very hard to kind of like separate out what is maybe learned, modeled behavior in families, like that great question about the intergenerational um, picking, and what is um, uh, nature versus nurture, basically. So somebody's asking about medication. So first of all, I'm a psychologist, not a psychiatrist, so I cannot advise about medication. And currently, there is no FDA approved medication specifically for picking. Um, but I would definitely consult with if you're on medication right now and you find that it's not helping, definitely consult with your doctor to maybe adjust a dose or just to let them know, to fill them in, "It's not helping, I'm not feeling, any relief." Um, Definitely would consult with a doctor, your doctor about this. But yes, can these strategies apply to curing an addiction, example, drinking or drugs? Um, the strategies, the ones that I have here, somatic tools, interrupt dissociation. Um, yes, curing an addiction, again, that word is very hard for me. It's leaning towards the perfectionism, the complete kind of stopping altogether. I think it can help, um, but definitely, yeah, these are definitely things that can help bring some space, help respond in a different way. Some great comments. Thank you, everyone. This question I answered. Um, so the link between hair pulling, and skin picking, hair pulling, and ADHD, we actually have a whole webinar on this. Look on our YouTube. There's a lot of information there. Um, somebody showing, somebody wrote about family picking, um, and showing, yeah, that's definitely unfortunate. And yeah, you're right. It could be learned behavior from that then. All right, everyone. Thank you so much for attending. Thank you for your helpful questions and comments. And I hope to see you at another webinar. Bye, everyone.